Hi everyone, my name is Joel Ramirez. I am the Director of Medical School Tutoring at MedSchoolCoach. I am joined today with Dr. Sherry Smith from TrueLearn, and we are so excited to be here with you today and talking about some kind of current updates in USMLE and COMLEX. The title of our webinar is USMLE and COMLEX during uncertain times. So a lot of challenging things going on right now, a lot of questions and a lot of unknown, and we're hoping to kind of solve some of these myths and give some information on how to be adaptable and flexible in these really challenging times. So this is a little bit more about us. I'll say something about my role, and then I'll let Dr. Sherry Smith kind of take it from there. So I am the Director of Medical School Tutoring, MedSchoolCoach. I went to medical school at UC San Francisco and currently a vascular surgery resident at UC San Francisco. I've been tutoring now in medical education for probably more than 10 years, and have specifically been involved in medical school education for now about 3 years, and I've tutored Step 1, Step 2 CK, and I currently run our division of tutors, which is more than 90 tutors who are really dedicated to providing amazing tutoring and exceptional services to our students. We have both USMLE and COMLEX tutors, and we work with several hundreds of students every year.
Thank you, Dr. Ramirez. My name is Dr. Sherry Smith. I am the Vice President of Academic Success here at TrueLearn. You may hear, if you're in the osteopathic circle, we're also referred to as ComBank. TrueLearn is our kind of umbrella name. My role here at TrueLearn, and I've been here for 3 years, I've been in medical education for going on 9+ years now, is to really help your institution, to help students who are preparing for licensure exams, as well as residents in their residency programs and physicians prepare for their board exams, help them be successful while using our Smart Bank. Prior to this, I was at Texas A&M College of Medicine, serving as or directing their medical education department. So I'm very familiar with kind of both sides of working with both faculty, administrators, where the pain points are, but also understanding that this is quite the investment, both physically, mentally, financially, for students. And this topic of the webinar today is, kind of significantly throwing a wrench in what is already a pretty difficult and a really time-consuming and life-changing event for you. And so we are both very excited to be presenting this topic to you guys. The agenda today is exactly what we kind of alluded to earlier is how do we approach these last-minute exam changes? You guys have had multiple emails either from NBOME or NBME about exam changes, exam cancellations, postponements, as well as the ProMetric Center, where you're going to take the exam, whether you're from a rural community or a site where there's multiple testing sites. They may have some cancellations, and you may have to shift plans around. How do we deal with that as students, and what does that mean, and how should that impact our studying and our future trajectory in medical school? Other things are, should you delay your exam? Is it a choice, right? So lots of good information there as we go into that topic. We're going to end with a few kind of housekeeping things and talk about TrueLearn and talk about MSc. But to kick it off is, briefly touching upon COMLEX and USMLE updates. Prior to these changes that most of you guys have experienced, there was some announcements about how COMLEX will change, how USMLE has changed, and will that impact you when you start taking exams? If delaying your exam, will you enter into those changes so that you can adapt and quickly start studying for any of those changes if necessary? And then talking a little bit more about TrueLearn and MSc.
Great, so we are going to dive right into how you adapt to last-minute exam changes. Also want to remind everybody that at the end of the webinar, we will be taking questions. So if you have any questions that come up during the webinar, if you think of anything, go ahead and write them down. You can put them in the chat, or you can put them in the Q&A, and we should be able to get to those at the end of the webinar. And hopefully it will be a really good opportunity for us to address your kind of individual concerns and questions.
Thank you.
All right, so the kind of question of the hour: my test got delayed or canceled last minute, what should I do? So this is, unfortunately, it has been a very common scenario in the last 3 to 4 months. I think it's improved a bit recently with the reopening of a lot of testing centers, but at the time, and within even a month, a lot of students came to us and said, hey, I've been studying for 2 or 3 months, been working really hard, I've been on track, and a week before my exam, it got canceled, and I don't have another exam in sight. Or, the worst case scenario, some poor people showed up to their exam, their testing centers, and then they were just closed. And so they kind of had their exam really canceled on the last minute. So what should you do? So the very first thing is just keep calm. So this is really stressful, a really stressful situation to be in. Again, I think I want to emphasize that all you have been working so hard to get through these exams and studying so hard, and having kind of, as Dr. Smith had mentioned, have a wrench thrown into your whole study schedule can be really stressful. So the very first thing is I want you to keep calm and to keep studying and try to stay on a plan. I think the most likely scenario is that you're able to reschedule your exam, hopefully sooner rather than later. The last thing you want to do is just stop doing everything for weeks on end until you have another exam date. So try to figure out when your next exam is, but until then, try to stay on track with what you're doing and try not to panic that this will work out. You will get another exam date.
It's a little harder to do to keep calm, right? I something that I struggle with when someone says stay calm, but it's absolutely the correct advice to stay calm, take a breather, take a couple days, reflect, and then come back and think about what are your options.
So I also think it's really important to emphasize that this is a very challenging and difficult situation. You're not alone in this situation. A lot of students have found them in this situation. I think one of the first things you want to do is get really frustrated over what is going on, but you really can't control this, and no one really can control what happens. So it's really important to really focus on things that you can control. And like we said, don't panic. It's not going to be very helpful for you to go down a spiral of panic and frustration.
Yeah, I think Dr. Ramirez, you said it exactly right, that there are other people, other students, both in osteopathic and allopathic and across the board, even in your residence, right, with canceled exams, rescheduled exams. And so there's a lot of students and physicians in the same boat. And so nothing is normal, but you'll get through it.
So one of the first things you really want to figure out is how long was your exam delayed for? So do you have another exam date? It's kind of the very first thing you need to figure out. So hopefully they have communicated with you, whether it's the NBME or NBOME, when you will be able to retake your exam. So the first thing you want to do is try to contact Prometric or go online and see if there is another exam date available for you. I think the most likely and hopefully the best case scenario is that there is another exam date in 2 to 4 weeks, and that you are either available to take that exam or you can delay a rotation to do that. So figure out when you can take the next exam, and that's really going to direct your next steps. Because if that is in 2 weeks, then you really are going to be okay, and you can just continue your studying for 2 weeks. In fact, you might be able to take advantage of 2 weeks of additional studying. Versus if it's going to be several months from now, then you're going to have to be a bit more flexible and probably talk to your school about changing your schedule around if you can. So the next kind of thing is if your next exam date is during a block or rotation, so even if it was 2 weeks from now, but you were cutting it really close and you were supposed to start your first clinical rotation in 2 weeks, or if the next exam is in 2 months and you're already supposed to be on a clinical rotation, then the first thing you need to figure out is, can you delay this rotation? And the most important thing for you to do there is actually to reach out to your school. So schools right now are very much aware of what is going on. A lot of their students are in this position. And so it's really important to really figure out, is your school going to have flexibility in this situation? Can they delay or swap rotations? So one example would be, making your first rotation there are like electives, like studying electives, or like a board exam elective. Can you put that at the beginning of the year and then do an extra clinical rotation at the end of the year? And that's what you're going to want to find out. And you're going to want to ask the administration what they are doing in this scenario. So how they create a policy of what to do. How are they allowing students to delay their exam for a whole year if they would like to? So the most important thing is you got to ask. I think a lot of these things are not, first of all, they're very dynamic at the moment. I think a lot of the schools aren't even sure what they're going to do with it. So the most important thing is that you're very open and honest with your institution. Tell them the situation that you're put in. Tell them when your next exam date is going to be or could be, and then see if they can be flexible and help you get there.
I actually heard a student contacted us not too long ago and had a canceled exam, and they couldn't find another testing center or another test date within the same testing center. And what they did was they actually, within the realms of being safe, right, had to find another testing center in order to have additional dates. And so there's a lot of kind of possibilities out there if you kind of try to think outside of the box. Ask for help. Ask your institution, your advisors. This is what I'm faced with. What should I do? And again, it is a dynamic situation. I won't be surprised if some faculty members or some administrators say, I don't know. And that's okay. And that's why we work it through and work it out with each student in their own individual case. So I definitely ask, what are my options?
So there are several things that you want to avoid in this situation. We've talked about a little bit, a few of them before, but there are a few things that you just want to make sure you don't do. So the first thing is panic. We keep talking about that. Don't panic. No need to freak out. Like I said, you're going to get through this, and this is a situation that a lot of people have been put in. And I really want to emphasize that, if you go about this situation correctly, I think that there could be several advantages. You could potentially get additional time to study, which could be really useful for you if you're able to work it out right. You want to avoid not studying all night. I mentioned it earlier, but the last thing you want to do is throw your hands up in frustration, stop your studying, and just sit around waiting for another test day. I think that is what a lot of students have done. I think maybe reasonably so, because it was very alarming and very frustrating to have their exam date canceled. But that's something that you really want to avoid, because if you're able to get an exam date in 2 or even 4 weeks or even 6 to 8 weeks, you really want to make sure that you're not having a lot of lost time, because a lot of the time, if you study for a long period of time, you start what you put into your brain, the same amount starts to leave your brain. And so you want to make sure that you keep putting things in your brain and not forgetting a lot of this material.
I think that's absolutely right. I mean, there's the concept of cramming, right? And I think we're all guilty of cramming during undergraduate, and then even probably through medical school. Is the night before a midterm or the night before finals, we cram everything that we can, and then take the exam. Your COMLEX exams, your USMLE exams, your STEP exams, and any further licensure exams are not the same. And so cramming will help you just a little. But consistent studying and keeping up with that will do you wonders. So definitely don't stop studying. If anything, take some questions, go through notes, just do something rather than nothing.
It's kind of alluded to what we had mentioned to earlier. Keep studying, even if it's something minimal, like Dr. Smith had mentioned. Even if it's just questions, the last thing you want to do is stop everything.
A lot of some of the tips that I've told students is, when things get hard, things get difficult, or you are feeling really drained, take that break and then come back to it. Set a study schedule, have an accountability partner, whether it is a Zoom group or a breakout group. Make sure that someone is checking in on you to ensure that, hey, are you studying today? Or did you take 20 questions today, 50 questions today? When you're approaching a study session, setting a goal. So today I'm going to get through 20 questions. and that is your goal. Or, I'm going to spend an hour and my goal is to maintain my 65%. That is another goal. And so setting goals, having accountability in yourself and having someone reach out to you will help during this time.
One of the another things that you really want to avoid, and that I've seen a lot with students, is you really want to avoid taking your exam while juggling other demanding responsibilities. And so a lot of students have recently, they've had their exam canceled. They get a retake, they get a new exam date in 4 weeks, but it's right in the middle of their first rotation. And they go, well, I can study full time for 1 more week, and then I'll start my rotation and I'll like study a little bit every night, and then I'll take my exam. And in my experience, that is very rarely a recipe for success. I think it's extremely hard to juggle clinical rotations or other really demanding responsibilities with these exams. They're very difficult exams, as you already all experienced. They really take 100% of your focus. When you start a rotation, you're going to be working, depends on the rotation, but you're going to probably be working 12 to 15 hours a day, 5 to 6 days a week. It's really hard to come home and to put meaningful study hours in, for USMLE or COMLEX. And so really, if you are, especially your first rotation, you're not really sure like what's going on or what you should be doing, it's going to be really hard for you just to stay focused on your exam. And I've seen students try to do this, and I'm not saying it's impossible. It's just very uncommon that we see a really successful result in this situation. So try to avoid that. And then avoid rushing into your exam. It's kind of like what I was talking about a second ago. Just because you can get an exam in 2 weeks, that may be useful. But if you start your surgery rotation tomorrow and you want to take your exam in 2 weeks, then that actually might not be a good situation. It actually might be better if you were able to delay your exam for a month or a few months, if that meant you got 2 to 4 weeks of full-time studying beforehand. I think that's really important. I know the initial reaction is like, you've been studying and working so hard for the last month or two, you want to take it as soon as possible. And with these exam changes, if you do that and rush into it when you're not quite ready or when you're juggling other responsibilities, then you might be disappointed with the result. And then there's a few things that you want to try to do. So we talked about this most of the webinar, but it's really important to be adaptable and flexible. And I think in many ways it's kind of frustrating to be told and frustrating to be put in this situation because you have no control of it. But I do want to emphasize that it's important to at least try to be adaptable and flexible and really try to focus on the things that you can control. This situation is very difficult for everybody, and not just for students preparing for board exams, but for clinicians, for educators, for a lot of folks. And it's just really important that you don't get in a spiral of frustration, and instead you really focus on things that you can control. And I think that will help you really focus on the exam and spend a little less time being frustrated. And you really want to stay focused on your goal. So it's going to be really important that you remain focused on whatever goal you're doing, because I think in the big picture, that's really what it's going to take to kind of get your score. Right now, you're going to have to overcome a lot of these challenges. And I think it's really important to stay focused on the goal of your, whatever score goal you have, and to really focus on the fact that, just because your exam is delayed doesn't mean that goal is no longer attainable. It's definitely something you can still do. It's just going to require a little bit of flexibility and adaptability on your part. And then I mentioned it earlier, but this could, if you plan this correctly, or if you are able to be adaptable and you work with your school to try to delay your exam, this actually could work out to your benefit. And this could give you more time to study, which really could help you in the big picture and help you score higher. So again, I would try to take all this advice and really make this negative a positive event.
Yeah, there are a lot of things. If it's 2 weeks, there's not a whole lot of things to change. But even within the 2 weeks or the 4 weeks or even the 8 weeks, I actually encourage students to, if it's available, take another diagnostic exam or sit down and review the blueprint or the content outline to ensure that you have everything covered. Utilize this extra time. While it's frustrating and you want to just get it over with, we understand that. Utilize the extra time and just kind of check in with yourself. Are you ready? Can I, take another diagnostic exam? Can I take another quiz? Have I, taken a good portion of untimed tests, and I want to ramp up some of my timed tests to ensure that I am going to, take the questions within the allotted time frame. So I would say there's a silver lining to getting some more time if you are maintaining this flexible attitude and kind of flipping it around to say, okay, this is out of my control, but what am I going to do with it?
And then we keep mentioning this, but I think it's really important to speak with your peers, speak with your faculty, and speak with your advisors. So especially when you're talking about rescheduling your exam, your faculty and advisors are really going to be people who are going to help guide you through this experience. And if you're talking about swapping rotations or seeing if your university will let you take your exam at a different time, these are the people that are going to help you get that done. So be really open and honest with these advisors, faculty, see what other students are doing, and see what they advise you to do. And then, I just really want to make sure that you take advantage of those relationships and that support system that you have.
Yeah, I work with a lot of faculty and administrators, and they have been even more flexible now more than ever, and kind of advocating, for the student, asking for extensions on subscriptions so they have extra time, paying for extended subscriptions because they know that an exam was canceled all the way until the middle of next year, and you need access. And so I can't emphasize enough, just like Dr. Ramirez, is to talk to your peers, to your faculty, to your advisors, lean on them, and see what your options are, and see what how they can help during this time.
Okay, so with all of this tumultuous stuff going on, it's going to be really important that you follow updates from the board exams and testing centers. So they're regularly releasing this on their websites. They're sending out emails, particularly if you've been enrolled in an exam, and they're also most of them, both NBME and MBOME have essentially like a coronavirus bulletin. So they post all these updates too. So it's really important to pay attention to those updates as they're kind of give some live information on what is going on with testing centers, testing requirements, and everything related to these exams.
So something to know, and I don't know, Dr. Ramirez, how you feel about this, is sometimes it's good to take Reddit or SDN breaks, because that could, I have found that sometimes it causes more panic and anxiety when you're reading updates or the what ifs, right? And so follow the updates from the boards and the testing centers. They will tell you exactly, what's going on, if other testing centers are being open, if there's alternatives to testing. So USMLE Step 1 and Step 2 have some alternative testing centers in medical schools. And so that's pretty big. But, Reddit and, some of the student forums, sometimes, it's good. They provide great insight and great information. I have found that taking kind of breaks from them have been really helpful.
Yeah, no, I agree. In fact, most of the time I recommend our students to stay far away from them. It's not the opposite. Instead of taking like Reddit or SDN breaks, it's like maybe just a little bit of time on SDN and Reddit. But in general, I totally agree that it's a very challenging environment to read and to be in. And there's a lot of information, a lot of good information, but also a lot of misinformation and a lot of like panicking and a lot of what ifs, like you were mentioning, that I think ends up just really not being that productive.
Yeah. I think it increases the number of questions that you have, and again, just the anxiety. And so the updates are extremely helpful.
Great, and we had mentioned this before as well. Just continue studying. Keep on keeping on. It really is. It's really going to be key here. And then if you're able to, it's going to be ideal if you could take your exam in 2 to 4 weeks. You spent all this time getting all this content in your brain. If you can get an exam in 2 to 4 weeks and you can continue studying for full time for those 2 to 4 weeks, and that is by far the most ideal situation. And I would recommend that to everybody. So try to get an exam in 2 to 4 weeks. If that means you have to delay your first rotation, see if your school will let you do that, because 2 to 4 weeks in that case is just almost like an extra 2 to 4 weeks for you to study and learn more, so you can even score even higher. And so that's really the ideal situation. And for everyone I'm talking to right now and all of our students, that's really what I recommend. Try to take the exam soon and work with your school to make that happen if you have to. And then in those extra 2 to 4 weeks, there's a few things that you can do during that time. I think it's very important to stay on your current study plan, but a lot of students have come to me saying, hey, my study plan, like the timeline was up until yesterday, which one was my exam was supposed to be. Like, I've now finished all my plan. What do I do now? And so if you have extra time to study, I always recommend continuing to do questions and really continue to do your focused content review. And I'll kind of talk about what that means, what I think that means in a second. And then continue your strategies to retain information. So I recommend for all students with these exams to have some sort of system to memorize. Some people do handwritten flashcards, some people do Anki, some people do tables, some people do lists. Whatever it is that you have been doing or that you identify that works for you, keep doing that. It's really important that you're still spending a few hours every day working on memorizing details and keeping those details in your brain. When I say focused content review, I really am referring to focused review of concepts that you find challenging. And I think that the easiest way to identify these is doing questions. So you do a question, you think you understand, heart failure, and you do the question, you get a question wrong, you're like, I actually don't understand this concept. Then take an hour or two and really dive deeper into that concept, go through some other resources and really expand upon that. That's what I mean by focused content review. So instead of starting from first aid, like page 1 of cardiology, reading 60 pages, it's really to focus on things that you find challenging and really continue doing questions. If you have exhausted question banks, if you've done every single question bank, then like redo your wrong questions. Or if there's a question bank that you haven't done yet, this is the time to do it with this extra time. I think doing those 3 things will help you stay on track during this extra study time.
I absolutely agree with you. There's this concept of, and I think a lot of students kind of fall into this category when it's close to their exam, right? And they are, even if it was delayed, it is kind of close to when they would actually have taken the exam. They move towards a more passive way of learning, which is like reviewing notes, just kind of going through the flashcards. And while that's good review, make sure that you engage in something a little bit more active, like Dr. Ramirez pointed out, the flashcards. Continue to write them down. Take questions in a question bank or a diagnostic exam on a piece of paper. Get quizzed by your peers, over Zoom. Those will act. Those are all active ways to study. And when you're testing yourself, that's what the literature calls, being a self-regulated learner, right? Knowing and being able to calibrate and to determine, do you know this concept or do you not know this concept? And the better you're able to determine that when you're approached with a question, the better test taker you will do on this exam and future exams. Right?
I've kind of talked about this before, but if your new exam is in the middle of a block rotation, I just really want to emphasize that you really want to avoid that. And so work with your school to try to delay your rotation or swap rotation. It's very hard to take a board exam in the middle of rotation. And I think most of the folks, at least preparing for step 1 or level 1, have not been in a clinical rotation yet. So I think that they don't quite understand that amount of the time commitment and the amount of fatigue that goes into these rotations. And then if you're a student preparing for step 2 CK or level 2, you kind of already know how challenging this is. And so you kind of already know that it probably is not a good idea to try to take an exam right in the middle of rotation. So try to avoid that and work with your school to help avoid that.
I think one of the biggest questions that we get from students who are taking or plan to take both level 1 and step 1, and what if one is canceled or one I'm not able to schedule? Because typically we recommend that you take them, somewhat close together, right? Because you're studying for both. For osteopathic students, we recommend that you take COMLEX level 1 before you take step 1, if you can, but take them relatively close together within a month. And right now, I think there's a lot of confusion and a lot of worry that the duration between the exams are a little longer. Any advice there, Dr. Ramirez, of, is it just kind of take it as it comes and schedule your exams when you can? What are your thoughts?
Yeah, I think, in the most ideal situation, you could still reschedule your exams so they're within 2 to 4 weeks of each other. But I do agree that at this point, you're really going to have to take what you can get and what's given to you. But I just want to emphasize, as long as you're studying full time and your entire focus is on these exams, I think that'll be okay. So I think technically, if your exam got canceled last minute, then technically right then and there you should have been ready, prepared to take the exam. So if that means you take level 1 in 1 week and then step 1 in 5 weeks, or vice versa, I think that's probably reasonable and probably okay.
Right. Should we delay our exams? And before we kind of get into it, I think you'll see a lot of yes, no's, and maybes. And I think when we were talking about this and discussing it, it really kind of depends. It depends on your situation, but we can go through each one of, the yes, no, and then kind of the maybe. But again, it is evaluating your situation, figuring out where you are, what kind of test taker you are, how prepared you are, and then speaking with your institution of what your options are. Dr. Ramirez, do you want to start with the yeses?
Sure, yeah. So in cases which you want to delay your exam, and when I say delay the exam, this could be 3 months, this could be 6 months, this could even be a year. I've had students who their schools were like, hey, we previously required step 1 or level 1 before you went to clinical rotations, but now that all those exams got canceled, we're waiving that requirement. So now you can take step 1 or level 1 whenever. So if you can actually delay your exam a whole year and take it after your clinical rotations, and you'll have 1 to 2 months of full-time studying, I think that could be a really great situation. So here's a few kind of what I think of like are hard yeses that you should delay your exam. So the first is if you're not scoring in your passing range. So regardless of the pandemic and regardless of last minute cancellations, I never will ever recommend a student take an exam if they're not scoring in a passing range on their diagnostics. So, that's just not, those diagnostics, they're not perfect, but they're pretty good. And the last thing you want to do is take an exam, not pass it, and then you're put into a position in which you still have to retake it, but now you have a failed exam, a failed score on your transcript. That's something you want to avoid. Not scoring your goal range, this can be a hard yes if you are particularly committed to a certain specialty. So if you know that you want to be a neurosurgeon and that there's nothing else in the world that will make you happy other than being a neurosurgeon, then you know that you need to score a certain score range. And so if you're not scoring in that score range and you know that that's the only thing in life that will make you happy, or that's the only thing that you want to do in medicine, then it's going to make sense for you to delay your exam. And then this will be like the 3rd or 4th time I've said it, but if it's in the middle of a rotation, don't do it. Delay your exam, figure out some other way around it.
Some hard no's. I'll take this one. So if the new exam date is too soon. So if you know that you're kind of, on the fence of whether or not you should delay it, but the next available one is, tomorrow, or maybe you scheduled it and it will take you some time to travel to that testing site. It may be too soon, and that might be a hard no. And yes, you should absolutely delay your exam and look for other options. If you're scoring in your goal range, don't delay your exam. If you're doing well, just keep doing it. I think I misspoke about the new exam date is too soon. New exam date is soon. So if let me rephrase that. If your exam is tomorrow, don't delay. If it is next week and you're ready to go, go ahead and feel good about taking your exam because you have studied and committed your time in studying for either level 1 or step 1 or other licensure exams. If it's required, so as flexible as your institutions are, as flexible as graduation requirements are, some of these exams are required for you to take in order for you to move on. Whether it's moving on to clinical rotation, moving on to graduation. So again, talk to your administrator, reach out to the boards and kind of discuss your situation or read up on the updates to see if it is required. If it is required, do not delay your exam. And then changes to the exam will apply during a new testing cycle. And so, in a little bit, we're going to talk about what are some of these updates that may impact this new testing cycle in 2021. If you haven't prepared yourself for those changes, you may not want to delay your exam to fall into that testing cycle.
Yeah, absolutely. And then the whether an exam is required or not, now is definitely a time to talk to your school, because some of these kind of deadlines or requirements are true deadlines or requirements. So from my understanding, most schools will not allow you to graduate unless you have a level 1 and level 2, or step 1 and step 2. But moving on to your clinical rotations, most of the time that is a institution deadline. And now is really the time to see if they're going to be flexible with that deadline and flexible with that requirement. So some schools now in their traditional curriculum have made step 1 or level 1 after their 3rd year. So there's really no hard and fast rule that step 1 or level 1 needs to be taken before your 3rd year. And so if you're in a position in which you think delaying to the end of 3rd year would be beneficial to you, talk to your school and see what they're doing about that, and you can just ask them, just be like, I think that right now is a bad time for me to take this exam. I think, given that everything is going on in the situation, maybe you have something going on in your family, or the pandemic has affected you in some other way, then see if they would let you take it a year from now, and see if you can get a month of elective time after your 3rd year to take your exam. It's the time to ask is now. They might not advertise it, but I think that you would be surprised at their willingness to work with you if you ask.
Yeah, there is one example that has come up recently is the level 2 PE, the step 2 CS exam that's been delayed because they're in-person exams. They've been delayed till next year. For MBOME, they announced that it's no longer a graduation requirement. It's definitely still a licensure requirement, but it's not a hard graduation requirement. And so there is some options to speak to your institution to see if you can delay it after graduation when you have some time to breathe and just study. And then a couple of maybes, right? These are definitely evaluate your own situation, where you're at. Some maybes is, you're scoring kind of on the fence. You're on the borderline score. You're doing well. Maybe you are just, a little under 400 or a little over 400. That's a borderline score. And on a great day, you can be over 400 for level 1. Maybe it's an off day and you score 396. And if you had the extra time to study, you could have kind of moved that needle a little further. And so those are maybes and things that you have to evaluate on your own. If you're mentally, emotionally, physically stressed, this is a very, very stressful time for everyone in your professional career and also your personal life, that you may not be ready mentally, or physically or emotionally to take the exam, and you may consider delaying your exam as well. Is your school flexible? Are they allowing you to maybe take level 1 and then delaying step 1 a year later, or vice versa? Right? Can you again delay rotations? Can you ensure that you have dedicated time to study so that you are truly ready when you can take the exam? And then is there free time after your clinical year? I have heard students where for osteopathic students, they are taking their level 1 and they've studied for level 1 and they're ready to take it. But they have delayed taking step 1 because it's not a graduation requirement for osteopathic schools. They've delayed it till after some clinical rotations or when there's a little bit more free time. So that's quite common, and those are also just options that you have. Is there anything else that you want to add, Dr. Ramirez?
No, I think that if you're not really sure about, these are all maybes, and I think the situations are different. The answer could be different depending on the situation. Talk to your administration. You can work with us or one of the tutors at MedSchoolCoach, and we can help you kind of come to a conclusion on what would be best for you. But this is going to be a situation in which you probably reach out and get help from others and see what they think as well.
Yeah, absolutely. All right, so we're going to jump to some COMLEX and USMLE updates that you may or may not know about. And this when we talked about testing changes in the exam for the next testing cycle, if you choose to delay, will this impact you? Have there been additional delays or changes for COMLEX and USMLE that you need to know about? And so we're going to briefly go over this. Again, all this information is available through announcements. I think, again, they're titled COVID-19 announcements through the MBOME or MBME. They're pretty good at either tweeting it out as well and posting it on Facebook, so follow them. But these updates are truly, truly valuable. So a few COMLEX updates for you guys is students of the class of 2021. Again, this is the discretion of your institution, but you can graduate without taking COMLEX Level 2 PE. Still a requirement for full licensure in all 50 states, but having that exam postponed or the option to postpone it might give you a little bit of breathing room, right? So that is one major update that was announced about a month ago. Another update that they announced back in end of February is that they're shortening the COMLEX USA Level 2 CE exam from 400 questions to 352. A lot of those items will be kind of the new test items that they're trying out, and so you may not. Those may be thrown out anyways, but they have reduced it from 400 to 352 beginning June 2020. However, the testing time will still remain 8 hours. And so previously, if you divide the number of items by 8 hours, on average for both level 1 and level 2, excuse me, is about 72 seconds per item. And so with the drop in item count, but with no changes in the time allowed, you're bumped up to about 80 seconds per item, and so that's a big shift, especially since we know that the item stems are a little bit longer and a little bit more tedious to go through, along with the multimedia components that you have to go through as well. So more time is definitely something that you need to practice and take questions on if you're going to be able to have more time. And then similar changes have been approved for COMLEX USA Level 1 beginning May 2021. And so look out for more information about that. Other updates is if you plan to delay your exam, or if you fall into the maybe category, should I delay or should I take it? The MBOME Board of Directors approved changes to COMLEX to limit the maximum number of attempts to 4 starting 2022. And so it may not impact you right now, but it may impact kind of your junior peers, but they are going to cap the amount of times that you can attempt your exams now. Your COMLEX Level 1 and Level 2 testing skin returns back to the blue skin. And so last year they tested the waters and introduced a lime green skin, and it did not go over so well. And so a lot of feedback, a lot of students submitted their thoughts to MBOME, and they've returned back to that blue skin. And so it's light blue. If you are using TrueLearn and ComBank, we have returned it back to that blue skin, but that's what you will see when you sit down for the Prometric Center. So it's just something to be aware of. Some of the buttons look a little bit different. So how you navigate the questions are a little bit differently. And then some additional changes can be accessed through this blog when we send this out a little later.
Great, and a few updates on USMLE Step 1. I think one of the biggest challenges were the Prometric site centers, the testing centers. And so the USMLE and MBME has really, they put in a few kind of processes in place to try to increase access to testing. So one of the things that they did is they're now allowing remote proctoring for MBME shelf exams. So you can then be able to take your shelf exams for your clinical rotations remotely. They are now kind of piloting medical school proctored USMLE Step 1 and Step 2 CK exams. They've currently regionalized this, so there's a few in the Northeast, the West, Midwest, I believe, the South. There's not a lot of schools right now. I think it's still less than 10, but they're essentially allowing students in their region to go to the medical school and take the exam there. So from my understanding is you actually have to go through if you're at a school in one of these regions, you go through your school's administration in order to try to take an exam at one of these regional schools. So if that might be an option, talk to your administration. Kind of the big and confusing news has been Step 2 CS has been suspended until at least June 2021. And so no one really knows what that means. It's been kind of a controversial exam as far as like its utility. They've also dropped a lot of hints that they might make it somehow like telehealth or some sort of virtual health. They've been a little elusive about it. It's unclear if it will return in its exact same format in June. And or if it returns at all, because it's been such a controversial exam. It's really unclear. They haven't released a lot of information about it. Regarding your licensure, at least for being able to practice as a resident, that is now waived for the moment. So you can move on to residency without your Step 2 CS and graduate for now. And then in later fall, they have mentioned increasing the number of items on Step 1 and Step 2 CK, kind of focusing on non-clinical medicine. But it's still unclear really what that means, how many questions that will be, what portion of the exam that will be, and what that means for you as the test taker. USMLE also kind of dropped a doozy early on and saying that, hey, they're going to shorten the exam in the setting of the pandemic, and then they kind of reversed and retracted that. So the exam currently is the exact same exam that you would have taken 3 to 6 months ago, same length, same number of questions. So that was kind of a misstep on their part.
Yeah. All right. So the last bit of information is talking a little bit about what we can provide for students within this situation, having a little bit more extra time to study, or, if you are getting ready to study and your exam is in a few months or even a year, how can TrueLearn and MedSchoolCoach assist in tutoring and utilizing the smart banks that we have. So just a little bit about us as TrueLearn. We work with a lot of medical students and faculty and residency programs across the board. So again, if you're familiar with ComBank, we are ComBank and it's powered by TrueLearn. And so sometimes we'll say ComBank, sometimes we'll say TrueLearn. But we work with over 600 residency programs. And so as a med school student, you may be utilizing us throughout med school, and then you get into residency and you will see us in residency as TrueLearn. And so we do have that kind of established partnership with medical schools across the nation, with both allopathic and osteopathic schools, and then as well as a lot of the residency programs across multiple specialties. A few things that we touched upon earlier about studying and why it's important to continue to study. There are some features that we have when you're using TrueLearn Smart Bank to help with that. One thing is what we call smart tips or smart cards. And so when you log into your dashboard, we actually will provide some exam insights. So for example, we follow the NBOME and MBME boards quite intimately. And we will tell you and feed you information about there's been an update, to the exam, or starting 2021, this exam will look like this. And so we will provide those insights within those smart tips. In addition to those kind of insights, updates, feature announcements, kind of words of encouragement as you go through the bank, you'll see these purple cards and also some green cards. And these are actually based on the learning literature out there. And so we are trying to make you a better test taker, right? So studying for licensure exams and beyond, what are some things and some strategies that you can implement across the board? For example, if you see a card like this, it says savings in relearning. If you forget something, learning it a second time will go more quickly and you benefit from having it learned before. So we scour through the learning literature, and we will kind of feed you this information, and you'll have a running history of these cards as well. The second type of card that you'll see, which is kind of a greenish color, are dynamic cards. As you take more questions in our Smart Bank, we will collect that kind of metadata and kind of feed you cards that are personalized to you. So, for example, if you are like myself and Dr. Ramirez, that we stay up all hours of the night. We are night owls, right? And if you find yourself logging in and taking questions 2 a.m., 3 a.m., 4 a.m., you may get a card that says, it looks like you've been logging in really late at night. And the research shows that, well-being is very important to retaining information as you're studying. You may get that card. And then your peer, next to you may not see that card because they're not logging in. And so this smart tips or smart cards is extremely helpful. The other feature that I want to highlight are smart texts. And so that what is included in your subscription, whether it is a personal subscription that you have purchased or an institutional subscription that your institution has purchased for you, is we take advantage of that practice retrieval. And so a lot of times what happens is you take questions in the bank and you've gotten them incorrect, or you're taking very quickly on your mobile app 10 questions and then you move on, whether it's to another course, whether it's to dinner, whether it's somewhere else, and you forget to review it. And so what we do is 3 days later, we will text you a bottom line or a key takeaway point from a question that you got incorrect in our Smart Bank. And so the idea is that we will kind of interrupt that forgetting curve, right? And so here we are. We're going to tell you about this topic. You probably forgot about it after day 2. Now it's day 3. You get a text on your phone that you can customize when you receive it. And you're maybe commuting, or maybe, this is a downtime and it's a focus study time for you. You'll get a text to say, remember, and then some information, and you can go back and retest. This last feature is particularly helpful at this time because you are towards the end of your, kind of your immersed study period. And you may go back and you may realize, I didn't understand this topic. I want to go back, but I don't want to just take questions in a big category. I want to do a very focused search. And so here on your dashboard, or even when you're creating your test, you can search by keyword or keywords of something very specific. You'll see 2 columns. The first column will display questions matching that keyword or words, and you'll be able to review it. You can see if you got it right. You can see if you got it wrong, and you can choose to maybe only select those questions that you got incorrect. The second column on the right are new questions. So maybe you got through 3/4 of the bank, and there are 200 questions that you haven't taken, but it matches that keyword. And so here you're going to see the topic of that particular question. You can't click into it because you haven't taken it yet, but you can certainly select those new questions and along with the previously taken questions, and create a very focused practice test from that. Some benefits of retrieval practice. I'll kind of highlight some of these big ones, and we mentioned it throughout the webinar. Is practice retrieval is a study strategy for long-term retention. And so you know a lot of these strategies, and we are finally just kind of coining it for you, right? But practice retrieval is actively engaging yourself in a true way to study so that you remember. It increases long-term retention compared to studying just alone. It reduces overconfidence. And so there's a lot of literature out there that have studied students who are overconfident, so they think they know it, but they really don't, or underconfident, meaning they thought they didn't know it, but they really did. Both those extremes are, in the learning literature, detrimental to how you perform. And so being able to kind of figure out what you know and what you don't know through testing, through taking questions, evaluating yourself and your confidence and whether or not you're guessing or not guessing will reduce that. And then the last thing that I'm going to highlight in this slide is that it helps lessen your stress experience on exam day. One of the biggest benefits from TrueLearn and for you taking questions and why you've heard continue to study throughout this webinar, and the importance of the testing effect or taking practice tests is because the more questions you take that simulate the exam, the less anxious you will be on test day. And so, going in and knowing that it's a blue skin versus a green skin, knowing where the icons are, knowing how to highlight versus, strike through, and what's available. Is lab values available or are they embedded into the item stem? So the more you know about your exam and what you're going to be tested and how you're going to be tested will help you on exam day, tremendously. Our big thing is to just study smarter and not harder, right? We want, this image right here is, we want you to feel like you are, on when you're sitting in a pre-metric center or a medical school, wherever you're taking your exam, that you're just taking a practice test on your couch, right? You know where the functionality is, you are ready to go, and your only job is, after, a few months of studying, after the delays, after the unexpected kind of hiccups along your way, you are kind of envisioning yourself as if you were at home, taking the real exam, but you're comfortable, you're ready to go, and you're going to be successful.
Great. Okay, I'll briefly talk about how to utilize tutoring and specifically what we offer at MedSchoolCoach. So I don't know if you've used tutoring before or not. I definitely had before medical school and even in medical school, but what we offer at MedSchoolCoach is a one-on-one personalized experience. So the way it works is you sign up for tutoring, you then get paired one-on-one with a tutor, and that tutor works with you one-on-one to get you to your exam. And so this tutor has been trained and is qualified to help you essentially in every aspect of your exam prep, from understanding content and foundations of concepts, creating a study schedule, helping with practice exams, working through your repetition of really challenging subjects, and then actually taking the exam and working through questions. And I think right now is a particularly useful time to take advantage of tutoring, because a lot of people are kind of thrown into this last minute, figure it out kind of yourself kind of situation. And I think that there's no reason you should have to figure it out on your own. There's definitely help that you can get. And I think that one of the things you might have noticed throughout our whole webinar is there's a lot of maybes, and it depends on your situation. And this is really a way where you can get a really personalized approach to your situation and a really personalized answer to your questions. And so we kind of will help you on every way and every aspect on your exam, on your path to your exam preparation. So the way it works is if you sign up for tutoring, you then fill out an intake form. This intake form requests a lot of information about you, kind of how medical school has gone so far, what have your practice testing been like, what resources have you used, et cetera, et cetera. We then take that information and we use that information to pair you with a tutor. And these tutors are people who are extremely experienced with education and medical education. They're really passionate educators. They're people who really care about teaching, really care about your success, and are really qualified. They've all scored in the greater than 90th percentiles on all their exams. I think one of the really important aspects of our tutoring program is if you come and you get COMLEX tutoring, we pair you with a COMLEX tutor. So someone who's taken and done well in the COMLEX, and you're not just getting paired with a USMLE tutor. And I don't think it's a one-size-fits-all kind of situation. There's overlap between COMLEX and USMLE, but I feel really strongly that if you're getting COMLEX tutoring, you should have a tutor who's taking the COMLEX and has done really well on the COMLEX. And I think doing all of these and helping in all these aspects really combines for a successful approach to the exam, helping with content review, helping with study scheduling, and helping with your approach to questions and work with your questions has really resulted in our students being able to score really high and do really, really well on their exams. We also have several guarantees. We really stand behind our tutoring at MedSchoolCoach. We're definitely confident that our students do well and they do better than without tutoring. So we have satisfaction guarantees, score guarantees, things that you can read more about on MedSchoolCoach.com. But I think the real take-home message here is that we have really experienced and really well-qualified tutors who are excited and who want to work with you one-on-one to help you be successful. And they can help answer those really difficult, maybe sort of questions and really take a personalized approach to your learning and to your success. All right, everyone. Well, that concludes our webinar portion. So there is our contact for MedSchoolCoach and the contact for TrueLearn. If you have any additional questions, you can find more information on our websites there. There's the email addresses there as well. Thank you for listening to us. Thank you for your time. And now I hope that you have all those questions ready, because we are ready, willing, and able to answer your questions. So please send those questions our way.
Perfect.
Hey everyone, thanks for joining us, and thanks for sticking around to the end of the webinar. I know we had a chance to answer a few questions in the chat tool within Livestorm, but here we are available to answer additional questions. I know some of you had submitted questions ahead of time. We do have that list of questions, so if there are any new questions to the chat or the questions tool, then we'll go ahead and answer some of the questions that you submitted. Once again, my name is Dr. Joel Ramirez, Director of Medical School Tutoring, and then joined here. I'll let her introduce herself.
Hey guys, this is Dr. Sherry Smith. I'm the VP of Academic Success at TrueLearn, and we welcome your questions, so send them our way. I know we have a list, and we have a few coming in from the chat as well. So do you want to, Dr. Ramirez, do you want to kind of start and pick and choose, and then we can kind of chime in and alternate?
Sure. I think I will take a quick and easy one that I see here is how is this step one constructed now that we're in the middle of a pandemic? So I'm thinking of the question is getting at, is the exam any different given the COVID-19 pandemic? And the short and quick answer is no. They haven't changed the exam at all. They had made an announcement, I think a few months ago at this point, that they were going to try to shorten the exam, but within, I think, days or within a week, they kind of backtracked on that and said that they're just going to be administering the traditional exam. So the short answer is the exam is no different, and it's from a structure standpoint. It's just a little harder to get an exam date.
Awesome. Let's see. We have some. So Maureen asked if there would be step one resuming in parametric centers, and I think we touched upon this a little bit during the webinar, Dr. Ramirez, but as far as I know, what MBOME has announced that some testing centers have resumed some testing, and they're offering some alternative testing sites as far as some medical schools to take step one. Have you heard anything different?
Yes, they're doing some testing sites, and then they're regionalizing some medical schools to offer the exam right now.
Yeah.
Another question we have is any advice for studying for shelf/step exam with shortened clerkships? You know, I'm kind of interpreting this more as how do I study for a shelf exam when I have less time? I think that depends on your curriculum, because I know some schools have shortened the clerkships, but they haven't necessarily forced you to take the shelf exam at the end of that clerkship. I would talk with your administration, see what their plan is. Some of the schools are allowing their students to take the shelf exams like all at one time as like a 6-month period in the middle of the year or at the end of the year. If you're somebody who is, you have less time to study, and you do have less time to prepare for your shelf exam, I think that the preparation was still probably going to be similar. I think it just makes it more important that you study every day and that you're very consistent with your studying, because cramming in that situation is not going to work. And if you only have 4 weeks to study, then you're going to want to make sure you try to get an hour or two every single day for those 4 weeks.
That's correct. I also know, Dr. Ramirez, a lot of the schools, knowing that there's some shortened study periods, they are implementing kind of soft barriers, some quizzing, ensuring that their students are prepared to take COMLEX. There is certainly some flexibility. So I do echo what Dr. Ramirez said. Please ask, see what your options are and see how they can help. There was a question from Trevor. He asked, this is specific to TrueLearn, about what the difference between a personal subscription and institutional subscription. As far as a student, there is no difference. You are still able to access the question bank just as if you were logging in. However, with the institutional subscription, we do partner with your institution and offer some additional insights. There's the functionality of quizzing, like I said earlier. And so it's a little bit different. We firmly believe that we are all in it to help you guys succeed. And we are here to help you guys do that.
Another question that a lot of people are talking about right now, can you discuss pass-fail changes and when it will begin? I'm hearing mixed information. So I think this is something we've spent a lot of time talking about, so I'm just going to address it very briefly. So the long and short of it is we don't actually know when this is going to happen. The USMLE said that it will happen soonest, January 2022. So if you are a second or third year medical student right now, you will likely be taking a scored exam. And even if you're a first year medical student right now, you will probably be taking a scored step 1 exam. And they said that's the earliest. So it's very possible that it's not till mid or end of January of 2022. So it's still a little unclear. And I think the one line big picture of what this means is it will just make step 2 CK or and level 2 just more important exams. I think if you rewind 5 or 6 years ago, most people actually only applied with one exam score, and that was a step 1 exam. Recently, schools have started to require step 1 and step 2 CK, but that's a recent thing. So I think what you're going to see is just a shift towards what it was like a few years ago, but instead of that one exam being step 1, it's going to be step 2 CK, which has pros and cons. It's, the exam, I think most people find it to be still very challenging. I think people also find it easier to study for because the content is a little more interesting. It's clinical medicine instead of like biochemistry and stuff. So pros and cons. But in big picture, I don't think it's going to be that big of a change.
I have heard from some of our PDs that we work with, how there's not controversy, but a lot of discussion about going pass-fail, especially USMLE going pass-fail, a lot of questions of whether or not MBOME and COMLEX will go pass-fail, and that's yet to be determined. But there is a kind of when we're talking with PDs, there's a lean towards focusing more on those clinical skills, those clinical exams, what that means. And so there could be a heavier weight. While MBME and MBOME have taken the stance that they understand that this is an unusual time, the metrics that are that they're using, for residency, they're just a little bit unusual. Some of the graduation requirements have been pushed, exam dates have been pushed. You may not be able to take the exam prior to applying because scores aren't available. And so all of that, take that all into account when you're applying, and those around you are in the same boat. So again, we said this maybe 3 or 4 times during the webinar, don't panic. Just do the best you can, take it as an opportunity to study more, take it as an experience to talk about. I think one of the questions that we got was, how do we utilize this when we go on interviews? Take it and talk about how you overcame this challenge and what that means for you and how it made you a stronger candidate for their program.
One of the questions we got asked, I think this might be a good one for Dr. Smith. I've heard that graduation from GEO schools must be within 6 years of matriculation. Is this true? And is this true given COVID-19? I'm not so familiar with that. Have you heard about that, Dr. Smith, that you have to graduate within a certain amount of years once you start? And did they make exceptions?
I haven't heard any changes to that. I've heard, like I said in the webinar, they're going to make some changes to how many times you can take it. And usually some of your resources from medical school may diminish a little bit the further out you get from medical school. And so those are the things that you need to think about. But I have worked with students who are 5, 6 years and still strong in studying for level 3 or step 3. One of the biggest questions that we got, and I think it's really interesting that that you and I can answer, is how would Ryan suggested, or Ryan had submitted a question about how would you suggest beginning studying? Seems like it's really difficult figuring out where to start, especially at this time, whether it's starting to study or continuing and maintaining that motivation. Any insight there? And I'll be happy to give my insight as well.
a very loaded question.
I know.
I think that the best way to get started is to make a plan. So think about what you want to cover. Think about how much time you have. Are you talking about 1 month? Are you talking about 3 months? I think there's a lot of resources out there. We've done webinars talking about resources. I would direct you towards that to get more details on resources, but I would start with that. Choose a few resources that you like and look at your schedule and how much time do you have. Sit down, make a plan. These plans can be elaborate, but the long and short of it is you want to make sure that you can have the time to get through all the resources that you've selected, and then just get started. Oftentimes it is intimidating to just get started, but if you get started, you have a plan, you have a set of resources, then that's a really great place to start, and you're going to learn as you go.
I agree with you. I think the short of it is to get started, whether that is starting small, making small goals, taking 10 questions, writing that down as a goal for a daily, something to shoot for daily. At least you start. When you start, you'll gain momentum. As far as losing motivation and, not having that motivation to continue studying, it's a difficult time, and it's good to recognize that. One of the things that we highlighted during the webinar is check in with yourself. How is your mental health? Are you feeling exhausted? Are you feeling, like you just don't have any more energy to study more? Check in with yourself, figure that out. And then when you are able to start small, take some questions in a question bank, go through some flashcards, create some flashcards, and then you'll kind of ramp up from there.
One of the questions is, what are the advantages of taking both COMLEX and Step 2, or USMLE and COMLEX? And I think that's actually a great question, particularly now that we've had the merger as far as residency programs. So I think if you're an osteopathic student and you're going to take the COMLEX exams, you have to in order to graduate. So I think that is a given. The question is, should we also take the USMLE exams, or is there a benefit to taking these USMLE exams? And I think there are, particularly if you want to apply broadly, or if you want to apply to programs that were historically, allopathic programs. Obviously, no one is now, they're not differentiating between osteopathic and allopathic formally anymore, but a lot of these programs who historically take certain groups of students are going to still take those same students. And so if you're interested in those programs or those kinds of programs, it can be really beneficial to take both of these exams. A lot of these program directors who traditionally take allopathic students don't really know how to interpret COMLEX exams. So if you can take both and you could do well in both, then that really is going to be a strength for application and could really help you out and could really broaden your opportunities at residency.
Right. I think you made a really important point. Is take both. If it's not required, take both if you score well in both. Because if you score well in COMLEX, or you pass COMLEX but you fail USMLE and it's not a required exam for residency, you do have to report your failures. And so think about that. It depends on how strong of a student you are. But if you're going to, think about it. If you're going to plan to take both, make sure you're going to score well in both. We had a couple of questions in regards to COMLEX Level 2 PE. Joel and Katie sent in some questions about updates to Level 2 PE, what that means. Is it possible that MBOME cancels Level 2 PE? At this point, we do not know. It is still
big black box.
I know, and I don't like giving that answer, but we are constantly checking the announcements to ensure that we know, how to best guide you guys as students. At this point, MBOME has not canceled Level 2 PE. They have pushed it from a graduation requirement to the institutions. If you want to be licensed, it is still required at this time. I know that exams have been scheduled, out until next year. And so at this time, it hasn't been canceled, unlike MBME with Step 2.
Great. There's a question that essentially asks, throughout your second year of medical school, how do you maintain the material? How do you keep up with material? And, I think when it comes to studying for board exams during preclinical years, I always recommend that you really focus on what's being taught to you in that whatever block or whatever course you're in until 3 to 6 months before your board exam. So, you know, the first year, the beginning of the second year, really focus on what's being taught to you. I think that's where you're going to get the most out of it. So really engage with your classes, really engage with your coursework. When you come 3 to 6 months before your board exam, that's when you want to start thinking about splitting your time. So maybe spend half of your week going through your coursework stuff and spend the other half of the week preparing for, you know, level 1 or step 1. That's typically what I recommend doing. I don't typically recommend doing Anki cards throughout first and second year. I don't typically recommend doing board exam questions until you're really studying for your board exam, which really shouldn't happen until 3 to 6 months before your exam.
I'm going to go ahead and disagree. What I recommend students is if you do choose to take questions in question bank or take board style questions, take the time to learn about the item stem, the item format, how it's written. A lot of institutions are moving towards assigning board style questions in their exams, in course exams. And so recognize that you have not gone through the curriculum. You may not score as high, but focus on supplementing the curriculum. And learning about the style of questions that you'll encounter when you actually go into a more dedicated board prep time. I'm gonna toss another kind of loaded question to you. Saya asked, how many questions should students plan to complete prior to their exam? And I know this is like the, you know, secret sauce, right? If I could take X amount of questions, then I can pass. I know that, you know, most of our, on average, most of our students that use our bank are taking about 1,200 questions and above. So, you know, that's average. We recommend that they go through the bank at least once so that they, you know, are looking at the questions. And if they have time, go through it again. Dr. Ramirez, how many times did you go through the question banks, and, you know, what is your advice?
Great question. I think that the bare minimum for a USMLE exam is to go through UWorld at least once. And I think if you're doing COMLEX, I think it also is reasonable to go through UWorld once at least. And then I think additional question banks are kind of over and above. And so then it's going to go, essentially the answer is really going to depend on you and your kind of preparation and how much time you have. So I think it's ideal to get through 2 question banks, maybe 3 if you have the time. 1 question bank kind of up front throughout your studies, and then 1 question bank done right before your exam. So you're doing 3 or 4 blocks of question every single day, really focusing on preparing to take the exam. If you are having very ambitious core goals and you have some time, then I think it's reasonable to do a 3rd question bank kind of earlier on in your study prep when you're learning the material. Some people redo their wrongs. I have not traditionally recommended students to do that. It works for some students. It doesn't work for other students. I often find that students remember the questions, and then you're just, instead of like thinking about a question critically, you're just trying to rack your brain about what the right answer was. I don't find it to be very useful. That's generally my thoughts on that, especially with there's so many good question banks available. I think it's reasonable to do. Just if you need more questions, just do another question bank.
I have students contact me when they're using additional question banks that may not have the osteopathic focus to it. And particularly a lot of students have said, well, I used one allopathic question bank and I kind of went through some osteopathic questions and I didn't score as high. I passed, but I didn't score as high on COMLEX, but I knew the material. And so I do highly recommend, if you're taking a osteopathic board exam, COMLEX level 1, level 2, to use a osteopathic distinct question bank like TrueLearn, just to study for that and take some time to review those OMM questions along with the other questions. The item formats between USMLE and COMLEX, while there are some similarities, they are written differently. And so make sure that you are using the bank that's specific to the exam that you're studying for.
Great. And I think that just about rounds up the amount of time that we have for questions. Thank you for joining us, everybody. Thanks for all the great questions. We had a huge list of questions that we couldn't get to all of them, but I'm glad that we were able to get to a lot of them, especially during the webinar. So thanks for joining us. If you want to learn more about TrueLearn or MedSchoolCoach, you can find us online. Otherwise, good luck studying and good luck with your exam.
Perfect. Thank you so much, guys. Good luck and be well.